we're in regenerative medicine. So
Mm-hmm.
regenerative medicine says I'm going to regenerate. I'm going to take old organs, old tissues, old cells and regenerate, repair them, make them young, youthful, and healthy again. That happens over time. So this is something that you would wear every day. You put it on in the morning when you get up, leave it on 12 hours, take it off, throw it away. Get up the next morning, put on a new one, 12 hours, take it off, throw it away. Same thing. You would do this over time based on your age. So pretty much, 1 month for every decade. If you're in your 50s, 5 months, 60s, 6 months, 77 months, or if you're like me, just stop patching whenever you want to start aging again. So we have a huge age reversal component. The longer people patch, not only do we see the differences in their body, in their skin, in their neck, in their face, and their, the way their skin feels, but we know that aging's an inside job.
Mm-hmm.
And so the longer they use the patch, I like to call, people's problems a grocery list. If you were going to work on all the issues you had, all the symptoms, all the problems, all the things you want gone that you didn't have when you were a kid, right? When you were younger, you weren't born with these things. So, they've developed over time. And so if you continue to patch, you'll be able to cross all those things off your grocery list and to be able to have the best quality of life and live a long, healthy life. I use the patch for prevention, for vitality, longevity, and overall wellness. I've never had any health issues or conditions. All the things that I've talked about that I've been into all these years, I've done to myself. And so I've kept myself very healthy. But I obviously work with that group of people, but I also work with, people that have varying different issues and health conditions. So this helps no matter what.
Wow, that's amazing. So much to unpack there too. So I want to talk about, you touched on the stem cells. And so let's tell people a little bit more about, inflammation and stem cells and sort of like reversing disease process. So like we're not making any claims specifically, but we know through studies that have been published and research that's been done that if you decrease inflammation in your body, you become healthier. And or inflammation is the root cause of all disease, pretty much in some way, shape, or form. And so, and in order, like you said, stem cells are the holy grail of healing. So can we talk a little bit more and like explain maybe a little bit more about that to help people understand why, like maybe, like, why do I care or why should I care if my stem cells are working or not, or, how many I have?
Yeah, absolutely. Yeah, it's a really big thing to care about. So like you said, inflammation is the root cause of disease. If you go to your doctor, you do blood work, they're looking at inflammatory markers. They're looking at your fibrinogen, hopefully. They're looking at your cytokines, your C-reactive proteins, the homocysteine. They're looking at your lipids and they're saying, okay, we have, your A1C, we're looking at these levels going, ooh, these markers are high. That tells the doctor that you are in an inflammatory process and you have disease taking place inside of your body, whether it's heart disease, diabetes, obviously we have Alzheimer's, dementia, cancer, autoimmune. I mean, you name it. Any of the things, any of the diagnosis from the doctor, they can look at that blood work and say, this inflammation is causing this. We have got to get the inflammation down. Where does inflammation come from? Well, obviously our environment. We are bombarded by, EMFs, 5G, radiation. We are bombarded with things in our air that were not there before. Our water source is contaminated. Our food, is that even really food? You sometimes you're like, oh, stay on the outside of the grocery store. And you're like, wait a minute, stay on the outside of the grocery store in the organic section, which may only be this big, or just go grow it yourself. Because what they're doing to the food today is causing massive inflammatory processes inside of the body. And so all of that, you may be like, oh my God, what am I going to do? Can I just like breathe air to live? You're like, not really.
Right. It can be overwhelming, even just thinking about that.
It can. And so that's what I love about this technology is there's so many things out there that cause inflammation every single day, personal care products, cleaning products, all of that. But we can only do what we can do, right? You can't live in a bubble. You just can't. And so this patch, because it elevates that peptide, GHKCU, copper peptide, one of the things that peptide does is bring down those inflammatory markers. That's a big component of it. And that's why we see people like, for example, athletes. I don't know if you know this or not, but a lot of athletes inject GHK on a regular basis into their body, like needle, syringe, and then injection. They do that for recovery, for repair, to reduce the inflammation so they can get back out there and go faster, because it helps with the circulation, the blood flow, being able to bring oxygen to all of the tissues and cells for faster healing and recovery. And so, and again, people with, anti-aging, right? They're very concerned about GHK. And a lot of times they'll use that injection in their protocol too. So again, non-invasive. This activates your own GHK, elevates your own GHK, because that's what this wavelength of light does. And we have clinical studies. You can go to startx39now.com. It's not connected to anyone. It's just a general website that we have that houses all of our clinical studies. And you can see the double-blind placebo-controlled studies, peer-reviewed, that show this actually elevates that peptide in the blood without being invasive, right? So you reduce the inflammation in the body. Okay, now what's happening for after that, GHK is elevated, is actually elevating, activating, and mobilizing your own stem cells. So like I said, stem cells are the holy grail of healing. You were born from a stem cell. Like literally you have an egg and a sperm, they frolic, and we have stem cells. And those cells turn into organ cells, heart cells, kidney, liver, tissue, whatever, right? And so once you're born, then you have some of what we still call pluripotent stem cells. And that's what keeps kids young and youthful, right? 5-year-olds don't have gray hair, 10-year-olds don't have heart disease, and 12-year-olds don't have back pain, all right? They have, their bodies are always repairing. Johnny can fall off his bike, break his arm, and he gets up and takes off running again. Like he's never missed a beat. Grandma falls out of bed, breaks her hip. She's not getting back up. Like the likelihood that she's going to heal from this is very, very small. And that's because as we age, like I said, those stem cells become dormant. They're not active in your body anymore. And so your body's ability to heal and repair and recover is declining. It's diminished. And so we see that degeneration process. So we can bring the inflammation levels down, those inflammatory markers down. We're elevating our own stem cells, waking them up, resetting them back to their young, youthful, healthy state. They go to work to do anything that's needed in your body, any organ, kidney, let's say, for example, a lot of people have kidney issues, right? And that's, you can see that as a extreme long exposure to toxins. We get into environmental toxins, pesticides, all that kind of stuff. And same thing with your liver. It's bombarded. It's your cleaner. And it's like, I'm done, right? Your liver's not functioning. And so it becomes damaged. We have fatty liver for people that don't even drink. They don't, you know what I mean? But sugar consumption causes all of this today in people. And so when you're able to activate your own stem cells, those stem cells, they go to work like they did when Johnny was a kid, right? They're young and youthful. They're saying, hey, let's go. I'm doing this. And your body knows how to heal itself. So you can't direct your stem cells. You can't say, oh, my kidneys are messed up, or, oh, my liver is, I need them to go there. You have to be patient with the process. That's why I talked about that time. But what will happen is these inflammatory markers will start to come down, and your stem cells will start repairing whatever's damaged. And so we see the body come back into homeostasis. So people go back 6 months later and they have their blood work done, or they go back and they, get their scans, their CT or their ultrasound or their MRIs, and things have changed. Or they go back to their eye doctor, right? And their vision has improved. How does your vision, how are you 70 years old and I have to reduce your prescription? That doesn't make sense. Or they go to their dentist and they're like, oh my gosh, your pockets are smaller. Like you don't have any dental issues anymore. How is that happening? Because of the body's stem cells going wherever they need to address the inflammatory process to be able to help repair and regenerate whatever's damaged.
Wow. Thank you. That was perfect. I love it. So let's talk about a little bit, what are the options within what Lifewave offers in terms of the different patches? Like you've mentioned the X39, which is this, I call it